Greetings, I am Sierra Thompson, a senior healthcare management student from Lake Wells, Florida.
Greetings, I am Nalia Gilbert, a senior pre-physical therapy student.
Hello everyone, I am Shalita Thomas, a pre-occupational therapy senior.
Greetings, my name is Wesley Altona. I'm a fourth-year pre-PT student from Port St. Lucie, Florida.
And I'm Zach Webster, a fourth-year pre-physical therapy student from Jacksonville, Florida.
And we will be covering the health disparities and critical health issues directed by Dr. Beck-Jones. First, we have Zach Webster, and he will be discussing how the Affordable Care Act affects health disparities.
The Affordable Care Act was created to advance efforts to reduce health disparities. It increased options for low and moderate income populations by up to 138% below the poverty line, and it promotes workforce diversity and cultural competence. It also includes prevention and public health initiatives such as free preventative services like birth control and free screenings. Since the provisions took effect in 2014, the uninsured rate for the non-elderly population dropped from 17% to 11%, declining most sharply for Hispanics, Blacks, and Asians. Even with this decline, they are still more likely to be uninsured compared to higher income and white Americans. 70% of American Indians and Alaska Natives who are Medicaid eligible are still uninsured, and Blacks are twice as likely as whites to fall under coverage gaps in the 19 states that have not expanded Medicaid. As our new president-elect decides whether the Affordable Care Act will continue or not, minorities will certainly feel the effects of whatever is to come.
Here's Shalita Thomas, and she will be covering Zubik versus Burwell and how it relates to health disparities.
The ACA has made an attempt to spread and equalize health care for everyone by including contraceptive and preventative care to women through their employers and connected organizations. The ACA, keeping in mind that some organizations may have their own religious convictions that go above the medical needs and wants of their employees, have provided an exemption form to them. The organizations on Zubik's side, which includes Little Sisters of the Poor, who care for over 13,000 elderly people, East Texas Baptist Church, and Geneva College, to name a few, claim that providing the exemption forms are a direct violation of their Religious Freedom Restoration Act of 1993. The act prohibits the government from placing a substantial burden, in this case the 2-page form, on organizations who choose not to participate because of religious reasons. As it relates to health disparities, Burwell has the notion that Zubik is attempting to gain control and rid people of their civil rights by way of religious veto. Taking away such rights as contraceptive and preventative care could possibly enlarge health disparities between women who may or may not already have access to health care.
Here we have a short video to illustrate some of the health disparities that take place in the LGBT community. Enjoy.
Here's Nelia Gilbert discussing African American mental health issues.
African Americans are no different when it comes to prevalence of mental health conditions. However, your concerns or experiences and how you understand and cope with these conditions may be different. Although anyone can develop a mental health problem, African Americans sometimes experience more severe forms of mental health conditions. Common mental health disorders among African Americans include major depression, ADHD, suicide, and post-traumatic stress disorder. Many African Americans rely on faith, family, and social communities for emotional support rather than turning to healthcare professionals. Only about 1/4 of African Americans seek mental health care, compared to 40% of whites. Cultural competence is a doctor's ability to recognize and understand the role your culture and culture of your doctor plays in treatment to adapt to this reality to meet your needs. Unfortunately, research has shown lack of cultural competence in mental health care. This results in misdiagnosis and inadequate treatment of patients.
Now here's Wesley Altona wrapping up our conclusion.
After taking careful note to each of the topics that were discussed in this video, it's clear to see that health disparities are either currently present or become present in time. At first glance, many Americans disapprove of the Affordable Care Act due to the rise of premiums and individual mandate that was put into effect because of it. In reality, it is one of the greatest tools this country has set up in place to help close the gap between the health disparities of the insured and the uninsured. Nelia Gilbert touches topic on the mental health status of many African Americans versus the mental health status of Caucasian Americans. This topic alone can count as both a health care disparity, which can be defined as a difference between groups in health insurance coverage, their access to care, and the quality of care they receive, as well as a health disparity. Not only do more African Americans continue to suffer from mental illness, but the available options for such treatment are not as abundant or as appealing to African Americans as they are to Caucasian Americans. Our final topic that we touched on was the Zubik versus Burwell case. Zubik is clearly against taking part in any form of the ACA and refuses to give a written form of documentation as to why. The decision to not cooperate will leave all those that fall under the Zubik umbrella at a disadvantage. The many options supported by the ACA for family planning will be out of reach, and they will have to see birth control and other forms of screening on their own. This decision may cause a disparity in the religious community versus those who are outside of it.